views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Dr. Jennifer Rosen, who will be answering your pre-submitted health questions. And again, if there are any questions that we do not get to this evening, we will make sure that we collect them and that we make sure that we answer it according to whoever asked the question. So my team will be in the chat. 1 second, let me just make sure that that doesn't happen again. We only have about an hour this evening, so we're going to jump right in. Before I pass the mic to Senator Rivera, I want to quickly share what my office has been up to in response to COVID-19, especially as it relates to everyone on the ground. Every single evening, my office has been prioritizing the application as well as the dissemination of information in order to cut through a lot of the uncertainty of this unprecedented moment. My goal every single day is to share as much information as possible regarding the state's responses, the city's responses, and then all of the resources that are made available to support New Yorkers while maintaining their safety. And so what does that look like in practice? Well, every day my team is on 3 separate calls. The calls are as follows. The first call is a call between the governor's office and the State Department of Health. The second call is a call between the New York City Mayor's office and the City Health Department. And finally, the Westchester County Executive and the Westchester delegation, because as many of you know, as a representative of the 34th State Senate District, I represent parts of Westchester County as well, but majority of my district is in the Bronx. Each evening, all the information from those calls are then aggregated and put into a nightly email to inform all of my constituents as well as others who have subscribed about the new guidance, the protocols, and best practices. All of our email updates are also posted online on my Senate page. My team will make sure that that information is shared with everyone. And if you'd like to subscribe to the email list, we will also make sure that you have the link to do so. In addition, my office has been putting on events like this, town halls, virtual town halls, and partnering with other offices and agencies to bring information and resources to our communities and really to answer your questions. My number one goal always is to bring the most updated, the most clear, and the most accurate information possible to the people that I represent. And it really is, again, something that I cannot do alone. And so oftentimes when I don't have the answer, I defer to the experts. And so that is why today is such a special moment while we're all together. So while my office is physically closed, I want everyone to just know that we are available Monday through Friday and truly really Monday through Sunday. We are working around the clock to answer all types of calls. The number to my office is 718-822-2049. Your calls will get forwarded to our cell phones, and that's how we'll answer your phone call. In addition, you can also email me anytime. It's biagi@nysenate.gov. I really want to make sure that we are responsive to the needs of everyone who is asking the questions. And truly, again, I have so much gratitude for everyone who's joined us today as a participant to tune in, as well as those who are on the panel. It's an honor, truly, to be able to share this time with you. So I will now be turning it over to the Commissioner of the New York City Health Department, Dr. Barbeau, to share an update about what is happening at the New York City level.
Great, thank you very much. And thank you to you, Senator Biagi. Thank you to Senator Rivera, Deputy Mayor Thompson, and my fellow panelists. And I want to give a special thanks to Dr. Rosen, who will be answering questions during the Q&A period. And I want to apologize in advance for not being able to stay for the entire teletown hall, but these are unprecedented times, and I wish I could have cloned myself, but it's just not feasible. But making myself available for teletown halls all over the city is really, I think, critical and part of what I see as my responsibility to ensure that we reach as many New Yorkers as possible directly to be able to answer questions and provide information. So my remarks, I will just talk broadly about where things stand with regards to the pandemic, COVID-19 here in New York City. And then I will talk more granularly about the Bronx, and then I'll talk about what we're going to be doing moving forward. And my hope is that that will give residents of the Bronx a sense of what's happening, not just citywide, but in the Bronx itself. And I have to apologize ahead of time that my email alerts may be distracting, but I think I'm just technology challenged and I haven't figured out how to turn them off. So I apologize ahead of time for that. But as you can tell, it's nonstop. So let me start by saying that clearly we are living in unprecedented times, and the numbers that I'm going to talk about are really staggering. And I have to be honest that never in my career did I ever think I would be saying these numbers and talking about what it is that we're all collectively dealing with. In New York City, we have over 150 people that have been diagnosed with COVID-19. And we know that that just represents the tip of the iceberg, because many New Yorkers have been heeding our advice that if they have mild symptoms, we want them to stay home. We don't want them to get tested. We want them to treat themselves as if they already have COVID-19. And the reality is that we're seeing benefits from New Yorkers staying at home. We are seeing decreases in the number of people that are being hospitalized with COVID-like illness. And we are starting to see decreases in the percentage of people that are testing positive because of COVID-19. But it's too early, clearly, to see these trends as anything other than early indications of the importance of us all remaining at home as much as possible. The other thing I want to sort of touch on is the staggering fact that over 15,000 New Yorkers have died. I mean, it's just gut-wrenching. And, you know, the sad reality is that Black and brown people are dying at twice the rate of anyone else. And that is an important piece of information, because we're not just talking about numbers, we're talking about lives, we're talking about communities and families. And it's critically important that we all really know the facts and commit ourselves to doing this collectively, because we all need each other. We know that especially in the Bronx, you know, our fellow New Yorkers that live in the Bronx are very hard hit. We're seeing high levels of cases, of hospitalizations, as well as deaths in the Bronx. And, you know, the reality is that it's due to the fact that we've got high concentration of individuals with chronic underlying illnesses like diabetes and heart disease that put people at greater risk for bad outcomes because of COVID-19. And that the true underlying drivers of that are generations of disinvestment. And so as part of our response, the city's response to COVID-19, the mayor and I have talked about an equity action plan, and he has talked about the various phases that this plan entails. Some of those phases have already begun and some of them are still to be launched. But I want to just let your constituents know that we have already done direct robocalls to over 1 million households across the city, including in the Bronx. And that really is because we don't want to take for granted that us blanketing the airwaves touches every single family. You know, we acknowledge that there are language issues, that there are a host of reasons why people may not be receiving the information that is so critical. So we've done the robocalls. We are launching direct mailings starting next week to over 1 million households across the city in multiple languages. And these direct mailings will have clear information about the signs and symptoms of COVID-19, and very importantly, how to care for loved ones that are living with you and have COVID-19 as a way to prevent ongoing transmission in households. That's a big concern of ours, especially in multi-generational households where we have grandparents living with grandchildren. And so we want to make sure that that message and those preventive guidance gets conveyed to as many communities as possible. Beyond that, we are also starting to work with community healthcare providers across the city, but especially those that are providing critical primary care in communities. And I'm talking about small practices with less than 10 doctors. We're not talking about hospital-based practices because we've already been working with them. We're talking about small practices that have been in communities that are culturally and linguistically matched to communities. So we're working with them to make sure that as a city, we provide them with support on doing telemedicine so that their patients don't necessarily have to come into the office, but can get the necessary ongoing care that they need, as well as offering our services to call their patients directly for them and prioritizing patients that may have hypertension, diabetes, the kind of chronic illnesses that put people, again, at greater risk, and also focusing on individuals who may be running out of refills on necessary medications so that we identify them early. One of the things that we want to make sure is that the message gets out that if individuals have symptoms related to COVID where they're not getting better and they're experiencing worsening symptoms or have chest pain, shortness of breath, we want them to call 911 to get medical services as needed. But we also don't want people to forget that if their diabetes is not well controlled, if they're out of hypertension medication, we want them to seek care as well. And so the other thing that I will talk about is the what we've been talking a lot about in public, and that is related to testing. And we are increasing testing sites across the city. Health and Hospitals is launching many more testing sites. People can call 311 to figure out which is the one closest to them. And we will continue as more testing capacity becomes available, making testing more widely available. We'll still want to prioritize individuals who are symptomatic, those who have chronic underlying illnesses, but we're also including first responders and others who really it's critical for them to be tested as a way in ensuring that our direct services to New Yorkers continues. And so that will be, has already launched, and we will be increasing those testing sites through H&H. And I think the last thing that I will say, just as my overarching remarks, is that we are at a critical juncture. There are indicators that we track on a daily basis, which include the percent positive from our tests, how we're doing with regards to the number of people newly hospitalized because of pneumonia, as well as our ICU capacity. All those numbers are moving in the right direction. And so we need New Yorkers to stay home even more to make sure that those numbers continue to go down. We will hopefully, and honestly, it's not soon enough for any of us, but we're taking a very measured approach. Hopefully soon we'll be making more announcements regarding next steps in terms of the testing and the tracing that will happen in the next phase of addressing the pandemic. And when we talk about tracing, it means identifying individuals who test positive for COVID identifying who they have come in contact with, and determining who's symptomatic, who's not symptomatic, to make sure that they stay at home for 14 days, because that's the way in which we're going to stop the ongoing transmission of COVID-19 in our city. It's not going to be easy. It's going to take a lot of work. There are going to be, I suspect, a lot of hiccups along the way, but that's really what awaits us. The last thing I want to say is, and I can't overemphasize, is the importance of not only remaining indoors, but if you have to go outside for essential activities, make sure that you use your face covering, make sure that you remain 6 feet from your fellow New Yorkers, and that even though we're asking New Yorkers to stay physically separated, it's really crucial that we remain emotionally connected. These are incredibly trying and stressful times. And I just want to remind you all of an amazing resource that we have here in New York City, NYC Well. 24/7, multiple languages. You can call, you can text, you can visit the website, but really critical resources for mental health supports during this time. And I want to just end in reminding us all that we're in this together, and that the next couple of weeks are going to be critical, but we can't do it without one another. So thank you.
Commissioner, thank you so much. You said that so eloquently and so graciously, and it really is such a privilege to have even this amount of your time because you are on the front lines dealing with this unprecedented moment, and it means a lot to myself, to my colleagues, and to all of my constituents who are watching this now and who will be able to watch this later. It really does. So thank you so much for taking the time.
Thank you. Thank you. And I'll stay on for a few more minutes. I have about another 8 minutes.
Okay.
Thank you.
Thank you so much. Next, we are going to hear from my colleague, the chair of the Health Committee in the Senate, Senator Gustavo Rivera.
Good afternoon, good evening to everyone. Good evening, Senator Biaggi. Thank you so much for the invitation. I will join my colleague in saying thank you, Dr. Barbeau, for being with us, and thank you for leading the efforts of the city. I am glad to know that there's someone of your caliber who is making decisions on behalf of all of us as it relates to public health here in the city of New York. So thank you so much for that. So good evening to everyone who is currently with us. I am Gustavo Rivera, State Senator for the 33rd District in the Bronx. I abut my good friend, Senator Biaggi. I represent the neighborhoods of Kingsbridge Heights, University Heights, Fordham. I go down to Belmont, cross the Zoo, and to Van Nest and Morris Park, and a sliver of Parkchester. I'm also the chair of the Health Committee in the Senate, and most of the work that I've been doing for the last couple of weeks in this surreal moment, although it feels like 27 years, it's only been a few weeks. Well, first of all, to anyone who is on the call or who is on the Zoom call here, and who is a constituent of mine, please know that my offices will remain open for the duration of this. My office is still working my folks are still working remotely and will remain open. I will make sure that I put the number on the chat. So if you need to talk to us on issues of unemployment, if you're having issues with your landlord, if you're having issues of access to food, or if you have issues with your small business, these are all things that my office is helping with on a daily basis. So that continues. One of the things that I have been focused on has been working on dealing with some of the things that have been done at the state level that need to be corrected a little bit. Two big ones that I can tell you that were big victories. One of them was to get the state to expand Medicaid to undocumented people, both for testing and for treatment. We wanted to make sure that you had access to it, that you had access to healthcare regardless of if you were struck with COVID-19, regardless of who you are or your immigration status. And I'll come back to that in a second. But another thing that we were able to also achieve, there was some guidance that was issued from the state related to telehealth services for mental health services for community health centers. And there were some issues around the way that they were getting reimbursed, which was something that was having a direct impact on community health centers all across the city and the state, many of which have seen as people have stayed home wisely and have been going to emergency rooms when necessary, that means that a lot of folks that would have been going to appointments at community health centers just haven't been doing it, which has had a tremendous impact on their revenue, which means an impact on their their longevity. And so we were able to get the state to fix that, and that was something that when I say we, my colleague in the assembly, Dick Godfrey, that's the chair of the health committee over there, and myself were able to fight for. We're also working to expand the capacity. The doctor talked about testing, and although certainly there is a need for the federal government to step up and increase the capacity of testing that we have to do across the entire country. And many of you know that I'm not necessarily the biggest fan of our governor, but in this I agree with him. This is not something that can be done on a state-by-state basis. The federal government needs to step up and needs to expand the testing capacity so that any other place that we see that was successful in managing this was successful because they had broad-based testing. Places like Korea or South Korea, Taiwan, these places had broad-based testing from the beginning, and they were able to manage it. I guess the last thing that I would say is that these are incredibly challenging times. But two quick things I want to say. First, most of you know I'm not from, maybe you don't know, I'm not originally from New York. I'm not from the Bronx. I'm originally from Puerto Rico. I was born and raised down there. But I came to New York in '98 and moved to the Bronx in 2000. And one of the reasons I fell in love with this borough is because of the resiliency of the people here. And so I will remind everyone that these are definitely tough times, but the Bronx has seen bad times before. And the folks who are truly committed to the community that we've built here are the ones that are going to make sure that we continue to build on that strength and get through it together. Lastly, I will say that this situation that we find ourselves in has demonstrated very clearly what some of the cracks in society are. And we need to make sure that as we go from the mitigation place, right, that we are right now, to make sure that we can keep people healthy and alive, that as we move towards to the point where we have to go back to, let's make sure that we don't put normal in there. We cannot go back to what was before. And there's a lot of things that we have to do to be able to address the inequalities that the system has, and many of us have pointed out before, but have been made so clear, whether we're talking about housing, about taxation, about healthcare. And on that one, I will finish by saying that if this is not a demonstration of how essential it is to have access to universal care for everyone, there is no better example of why we need to do that. And we can do that. In the state of New York, there's a bill that I co-sponsored by my colleague in the Assembly. I'm sorry, my colleague in the Senate, both folks who are here, the New York Health Act, which is a bill that would actually get us universal coverage to every single New Yorker, a system in which we are relying on our health care, depending on the job that we have, is one that doesn't work. I mean, we're seeing it right now. Millions of people are out of work and they don't have access to their health care. What happens if those people get sick? And they will, because they're human. So we will have much more work to do, but for now, just know my office continues to be open. If there are issues, either micro or macro, that we can help, that my office and myself can help solve, please let us know. I am here, and I am looking forward to working with all of you, my colleagues, and all the folks who are here on the call, so that after we get through this, we make sure that we do not go back to normal, and that we push bold ideas to try to address the concerns that have been made so clear about the breakdown in our system that have been made so clear by this crisis. I thank you, Senator, and I will remain in the background here and available to you. Thank you for the opportunity.
Senator Rivera, thank you so much. You said something that I often refer to every single day, all day long, really, which is that as challenging as this moment is, it's a portal of transformation. And on the other side of it is a new world. Yes. Where we have to be brave and bold. And that is so important for everyone to just keep in their minds, that as painful as it is, we have an opportunity here. A once in 100-year, I've heard, but I really feel like it's a once in 500-year opportunity to really change the way we do things for all of our essential needs. And so with that, I often refer to the 4 pillars of one's life that are essential, right? Healthcare, a good job, having a roof over your head, and a quality education. And so it is my privilege really to introduce now the chair of the Education Committee, my colleague and someone who has been a real mentor to me, Senator Shelley Mayer.
Thank you, Senator Biaggi, and thank you for inviting me. And really, to the people who are listening, you could not have fiercer fighters than Senator Biaggi and Senator Rivera. I think you hear the passion in their voices, speaking for not only their communities, but for equity and justice, and not going back, as Senator Rivera said, after this is over, to the way it was before. There are many lessons learned, and we need to move forward and change the world as a result of these. I think I was here invited. I'm the 37th Senate District, which goes from the Bronx border, but not the Bronx, on McLean Avenue in Yonkers, all the way to the Connecticut border in northern Westchester. And I'm here because I'm the chair of the Senate Education Committee. There is a chair of the Senate Committee on New York City Education, our colleague Senator John Liu. And I, unfortunately, will drop off in about 20 minutes because I'm going to speak to a bunch of parents from my district. But my interests here today are in making sure I hear what people have to say, particularly about two major concerns: when and how schools reopen in New York City, and the issues around reopening concerns of parents, teachers, and all of the other stakeholders in how are we going to do this, and how can we address some of the things that have happened as a result of distance learning to our students, particularly those students who are more vulnerable, a range of students who are not going to do as well in this environment as they did before. And secondly, what happens if there are additional cuts, and how can we fight against that? That is something that is on the table. We need to fight to get more money from Washington for the state of New York, for our city, the city of New York, and for all the municipalities, as well as direct funding for education. We are not fighting against healthcare. This is not a time to fight to have healthcare cuts or education cuts. These are essential elements of our democracy, and we need Washington to step up. So I have other ideas on how to get more money into the system, but right now our focus is tell Washington, New York is the hardest hit. You must really help us now, as we have always helped you. And together we can get past this, but we cannot acknowledge and accept additional cuts in education or in healthcare. So with that, I'll be quiet. Thank you, Senator Biaggi, Senator Rivera. Pleasure to see you both. And I look forward to listening.
Senator Mayer, thank you so much. And for those of you who have either just joined or who are joining us, Senator Mayer is the chair of the Education Committee. She has a very long history fighting for the needs of students across the entire state. She represents a portion of Yonkers, which has some of the highest needs, I think, of any school district across really this entire very large state that we have. So she understands the needs of really where we go now from here after this pandemic is over, and really how to uplift and make sure that our communities rise. So it's really just such a delight to have you on today, Senator Mayer, and I'm very grateful that you're here to listen and to really support this moment. So thank you again. Next, we are going to hear from Philip Thompson, who is the Deputy Mayor for Strategic Policy Initiatives. He will give us an update on the workforce development efforts during COVID-19, which, as you all know, have been really at the top of so many people's minds, right? What's going to happen next? What do we do? Tell me about my job. What if I was laid off? What if I was furloughed? Where do I go? Who can I turn to? This is why the Deputy Mayor is joining us today. So thank you so much, Deputy Mayor, for joining us, and we look forward to hearing your updates.
Well, thank you, Senator Biaggi, and hi, Senator Rivera and Senator Mayer, and also Dr. Rosen, my colleague with the city. I'm very happy you invited me, and I hope everyone is well and safe as they can be. Let me just start by saying that a good place for information on a range of services that the city provides is to go to the website nyc.gov/coronavirus. And on that website, there's information on where to get food, there's information on employment, on health insurance, on housing, and many other issues that people are dealing with right now. There's also information, a link for businesses and nonprofits. And you can also get real-time COVID updates in English. And if you text COVID ESP or COVID Español, you can get updates in Spanish. If you're looking for work, you can go directly to the Small Business Services Workforce One Career Center system by typing www.nyc.gov/site, SITE/help now NYC. And there, the city is working with industries and service providers and hiring, particularly in the areas of healthcare and food. I will also mention that the labor union 1199 SEIU, their employment center is also hiring and placing people in healthcare jobs. And both the city and state are running healthcare portals now, where they are also recruiting people and placing them in jobs. Some of the jobs that we're really focused on hiring folks for now are administrative roles in long-term care, like nursing homes and home care agencies, clinical roles in nursing homes. We're also hiring for dietary workers and environmental service workers in long-term care. So there are a number of opportunities and resources that are available, and they're beginning to emerge online job training programs. So you can actually take an online course and get qualified to take one of these jobs, even if you don't have a background in that area of work. So I'll stop there.
Deputy Mayor, thank you so much. My team will make sure that those links are in the chat and that they're shared as well. I have to say that of all of the resources available for workforce development, the fact that you're also providing training is such a significant input at this moment, because while people are losing their jobs, there are still jobs out there because there are still needs. And so it's really just a testament to your dedication to the people of the city of New York. And we will make sure that all of the people that we represent, especially those in the Bronx, know what those resources are and are available to them, because so many people have been laid off and furloughed, and we want to make sure that we bridge that gap together to those who have the need, the unmet need, and meeting that need with what you're providing. So really, thank you so much for that update.
Thank you.
Next, we are going to be hearing from Maisha Ross Porter, who is the Executive Superintendent of the Bronx. She will be giving an update on what the Department of Education is doing, specifically in the Bronx during COVID-19. We couldn't be more delighted to have her join us today. I've heard her speak several times. She is as fierce as they come, and I'm just grateful that she is here in this moment fighting with us for the things that all the students in the Bronx and all 5 boroughs really need. And we also know, of course, that whatever New York City fights for is really just the way that the rest of the state often is taking the lead from. So thank you for your leadership at this time, and I'm really looking forward to hearing your update.
Well, thank you, Senator Biaggi, and thank you, Senator Rivera, for having me. Greetings to Senator Mayor and Deputy Mayor Thompson. I'm really excited to be here to represent the educators of the Bronx, and even more excited as an educator, our number one learning is to, when you hear good stuff, make sure you take it and make it your own. So I'm gonna welcome myself to enter into the portal of transformation, because that is where educators are going to have to go as we move into our new normal. Which is exciting. And that's something I've been talking a lot about. So I'm going to ground us in some things that are happening right now, but also just share how we're thinking about who we are as educators post-COVID, because that's really important. So in the Bronx, we're operating 11 rec centers, and those are the centers which serve the children of New York's essential workers. It provides them with a safe haven and an enriching place to go. And those centers serve medical workers, first responders, transit workers, restaurant, grocery, and food workers. And I just want to acknowledge that, many of our residents who haven't been heroes are heroes right now. They're the grocery store workers, the nurses, those people on the front lines in the bodegas who are showing up for us every day and making sure that we have all of the things that we need. I'm excited about tablets, and I just want to lift up that Bronx principals, and I know this happened across the city, but we have a different need in the Bronx, and that's something we are really uniquely aware of. Bronx principals were rolling out devices even when they weren't supposed to students because they knew what the need was. And so I'm excited to say that across the city, 240,000 iPads have been distributed, with 48,000 being delivered to families in the Bronx. The opportunity to obtain those devices is still open, and so families who need them, and this is what I say to families, we also know bandwidth and internet access is an issue. And so even if you have a device, if you don't have internet service and Wi-Fi that you can depend on, families should be applying for those devices, because we want to make sure all of our students are connected. And those iPads come internet enabled through T-Mobile, so shout out T-Mobile, so our students can access remote learning online automatically. And I'll put in the chat how to get those for families who still need them. We have 106 feeding sites in the Bronx across all our schools. This week, the DOE expanded the grab-and-go meal hubs to include kosher certified meals, and so that's really important as we think the needs of families. And we're grateful for educators and principals the work they are doing to support students and families with remote learning during this crisis. We're tracking student engagement with remote learning with a focus on meaningful engagement and not attendance. And we're seeing over 85% of our Bronx students engaging in remote learning, which is a testament to the work and commitment of all of our educators. And I just also want to lift up not only our teachers who are doing God's work, but our guidance counselors, our school aides, our paraprofessionals, our parent coordinators, all of those folks that are really doing the work now to make sure our students get connected. And I also want to add that remote learning is not just about a device. And so I also want to thank Bronx for partnering with us in order to create a space for the Bronx Education Network. And it is a space where teachers can create short lessons that will be broadcast on public television through BronxNet. We also have paper packages that teachers are connecting with them around. So we know that remote learning is not just, again, about connecting with the device, but how we connect with our students to ensure that the learning continues. The grading policy came out yesterday, so I know that's high on people's minds. And I just want to share really quickly a few things I shared with Bronx principals today about my priorities for the borough as it relates to the grading policy. And so one, we are looking at examining our grading policies with an equity lens, keeping in mind that our families and communities are in very varying places as it relates to this virus. The Bronx has been disproportionately hit, which happens because of all of the reasons that Dr. Barlow outlined. And so how are we really thinking about what's happening in our students' homes, what's happening in our teachers' homes, what's happening in, we have had principals who've lost parents, like there's such loss happening in our community. And so how are we examining, approaching grading and learning and teaching through an equity lens? And how are we exercise ability in that process, but also ensuring our commitment to high expectations, and using this grading policy as an opportunity to give clear feedback on students' next learning steps. And we also, again, this is going to be to when we get back, right? And so we understand that not only will our students, and this is something as Bronx educators we think a lot about, not only are our students going to have social and emotional needs that, but so will our teachers, so will our leaders. And so we're looking to expand school-based clinical social workers, restorative practices, social practices. We're looking to ensure that students have access to the same supports that they had in school remotely, and if they need support, have the ability to reach out to their guidance counselors, social workers, and teachers. And finally, schools that have experienced the loss, and that has been very real across our borough. Crisis team to be mobilized to just ensure that we're supporting principals, teachers, and other folks. How do we support the community remotely? Because these are untraditional times of loss where we can't gather and connect. And so that's what's happening across the borough. And again, I think that this is an opportunity. On the other side of a crisis, on the other side of a problem is an opportunity to come up with a creative way to solve. And so what we're really thinking about at the borough office, with my work leading the superintendents and the professional learning folks and the directors of our office, we are really now remotely diving into the online learning standards, which is not the space that we're in. But what we want to be prepared for is, one, we want to get back to school. We miss our babies, we miss our classrooms, we miss our teachers. We want to get back to school. But we also want to be prepared for if this pops back up again, how we better prepared to jump to remote learning. Teachers, educators, school leaders jumped in with 3 days notice and turned around the system really quickly. And so we're also thinking about, one, how do we leverage technology to a greater extent on the other side, and how are we prepared for the future as it relates to this moment.
Thank you so much, Superintendent Porter. We are so grateful to have you. I know that there was a little bit of choppiness with the connection, but I heard you still, and any of the resources that you shared vocally, we'll make sure that we also put in the chat. And for those of you joining us on Facebook, thank you so much. We are now entering our Q&A portion, which will be moderated by myself, as well as Senator Rivera, and we can just get started right away. So I'm going to begin, and then it will be kicked over to Senator Rivera. So the first question is actually for Dr. Rosen. Now remember, Commissioner Barbeau could not stay on for the entirety of this town hall. So we are so grateful to have Dr. Rosen join us. And so the first question, Dr. Rosen, is for you. And the question is as follows. What are plans for ongoing expansion of COVID testing to become citywide? And how will you make sure the Bronx gets equitable access to diagnostic and antibody testing? This is something that we've heard probably every single day of this entire crisis.
Sure. And first of all, I just wanted to say thank you so much for having me here and for the opportunity to speak with everybody. In terms of background, I know many people were very concerned that the testing was not widely available in the community, and we as a health department had not been promoting that outpatients seek testing, and really that testing be reserved for hospitalized cases, not just because of a lack of available testing kits, but also because it's so important for sick people to stay home to avoid spreading infection to other people. And also because if you're sick, you may not actually have COVID, it may be something else, but by going into a medical setting, you yourself could be exposed. But at this point, there has been recent implementation of community testing sites. And this is really just the start of the city's plan to expand testing on a broader scale, now that we seem to be on the right side of the curve, and now that case counts seem to be going down. And the community testing sites are specifically placed to ensure that residents who are most vulnerable have access to these diagnostic services. So currently there are 2 sites in the Bronx that offer community testing, both run by health and hospitals. And this is really geared for people who are age 65 years and older, and or who have underlying health conditions. These are walk-in sites at Morrisania, and also at Morrisania for NYCHA residents and Belvis. And the city will continue to expand testing by first focusing on the communities that are hardest hit by COVID.
Thank you very much, Dr. Rosen. I know Senator Rivera and I say this all the time, but the Bronx is 62 out of 62 for health outcomes. It's not a proud badge, actually, right? Because it means that we have the worst health outcomes in the entire state. And so we're grateful to have your voice on this, to have your awareness of this. And I know that you already know that, so I'm grateful to have you as a partner in this fight to make sure that everyone gets tested.
Thank you.
Yes, thank you. The next question is for Executive Superintendent Porter. The question is, what are summer school programs going to look like? And do you anticipate an increase in students needing additional learning opportunities over the summer? This is an excellent question.
So can you hear me better now? Great. I think, the internet went crazy. That's why we have to have other options in remote learning. So first, I would say summer school is still being discussed, what it will look like. A lot of that is going to be determined by where we are in the virus. I also say every student in New York City right now is a SIFE student, a student with interrupted formal education. And so we need to be thinking about each and every student and what in this time they will need to get back on track in the way that they were. So what I have seen is the heart and soul of educators really pouring into students in a very different way. I don't expect there to be a greater number. I expect there to be a more targeted number of students with specific supports connected to what that time looks like for them.
Thank you.
Oh, and so I'll just so the folks that are watching know, these are questions that were all previously sent to us. So we just want to make sure we get through these, and we will probably get to some of the ones that you have asked. But this would be to Dr. Rosen. So out of all the boroughs, as we talked about, obviously the Bronx is the highest rate of infection. And so if you were, and I know that you've spoken about some of the testing that's going to be increased, but what are some of the community-based initiatives that are happening to combat this that you can tell us about that you're aware of at the city level?
Sure. So the health department is driven by equity, and that really guides every decision that we make as an agency. Structural racism, poverty, and inequities have left communities of color vulnerable to many chronic conditions, which makes this particular crisis, COVID-19, even more deadly and inequitable. So various things are being done. The Bronx Bureau of Neighborhood Health puts our communities really at the center of their work and ensures that programming and services are based on stakeholder input and informed by neighborhood level data. An action plan is being developed to engage and channel more resources to our hardest hit communities, including the Bronx. And some of these things will include a focus on public hospitals to make sure that everybody gets health care regardless of their background, zip code, or income. There'll be a public education campaign, and this will be focused on communities of color and communities where English may not be their first language. There will also be a provider call line where people can call 311 with COVID-related concerns to talk through their situation and to get more advice. That's among other things.
Gotcha. And then changing the subject for a second, actually, to Deputy Mayor Thompson. One of the things that is concerning to all of us, obviously, is unemployment, about employment, small business resources, et cetera, that are hard to get for just everyday folks, but obviously undocumented New Yorkers have another barrier to deal with. Could you tell us a little bit about what are some of the resources that are available to either employment, unemployment, and small business resources to undocumented New Yorkers?
I will say right off the top, not enough. The federal programs are restricted and are not undocumented workers or businesses run by undocumented workers are not receiving the support they need usually from the federal programs. However, we have a listing of all kinds of supports available to all immigrants, regardless of immigration status. If you go to the Mayor's Office of Immigrant Affairs, and that website is nyc.gov/immigrants/coronavirus. And this website is available in 10 languages. And there's information on food, education, worker support, financial assistance, public safety, legal aid, and more. The city has been soliciting money from philanthropy, from foundations to support immigrant workers. And recently we received over $20 million from the Open Society Foundation. And the Mayor's Office of Immigrant Affairs is working with local community groups that serve undocumented workers to start distributing aid next week from those funds, and we're raising more. We also ran a grants program that was open to small businesses, regardless of immigration status. And I tell you, we had about 8,000 businesses apply, and it started off with $8 million, and we ended up spending about $30 million that went out the door in a matter of days. And a number of the small businesses that received those grants were immigrant businesses, and we don't ask questions about documentation, but we think a number of those were undocumented. Right now, we do not have money to continue that program. And if we get more money, whether it's federal or whether as tax levy money increases, we want to do more of that. We would also love for the state to do that. The state of California, the governor put $75 million made available for undocumented workers and businesses. And that's on top of what cities.
I'm sorry. Could you say that? Could you say that again, please? The governor, what state again?
That was California.
What are they doing again?
$75 million for undocumented workers and businesses run by undocumented. And this is on top of what cities like LA did, because they also put out more than $10 million and so forth. So the Open Society Foundation is a private organization. They put up 20 million. So, I think the state ought to triple that at least to help undocumented workers. And a lot of the people who are doing these essential services, like delivering food, like working in groceries, like taking care of people, are undocumented. A lot of the home care workers who are riding on subways without, proper protection to take care of elderly people so they don't end up in the hospital are undocumented workers. And so, we just think, back to what Commissioner Barbeau said, we really have to make this a more fair and equitable city. And if some of us are in trouble, all of us are in trouble.
Indeed. Thank you, sir. Alessandra?
Yes. The next question, and that was, by the way, that was perfect. And primarily because I feel like so much of, as legislators, what we compare New York to is California. California is always lapping us. It is so frustrating. However, I know one day we will get there. And it's good to have a kindred partner across the other side of the country doing what is right. So the next question is for Superintendent Porter. I'm sure that so many people have this right at the top of their minds. What resources are being provided for parents who don't speak English and are doing remote learning for their children?
So our supports at the borough office are on the ground working with schools and teachers. Additionally, packages are being sent to the homes of students, English language learners who don't have devices in their language so they can continue to access learning. And a number of resources are available in many languages, but those frontline, again, teachers, English language learners, teachers that are supporting our students are connecting with them, again, in a remote way, either through the phone, through the internet. And so we are making sure that we continue to support all students and meet their needs by providing resources in multiple languages and connecting them with the teachers who've been supporting them all along.
Awesome. Thank you so much. Senator Rivera?
There was another one that you had there. So actually, yes, I have a question for you, Senator Biaggi. We have a whole thing. I want to make sure I do this right. I can't mess it up. So, Senator Biaggi, I have a question for you. Mm-hmm. Coca-Cola employees in the Bronx are not getting paid. the 10 days that the governor granted if they don't get an order of quarantine from the Department of Health. So they're using their sick days and are being told to apply for disability. How can companies get an order of quarantine from the Department of Health?
Such a very good question. Okay, so let's take this issue from the very top. The law right now, as it stands, provides guaranteed job protection and paid leave for New York employees who are unable to work while subject to COVID-19, precautionary, this is very important, or mandatory order of quarantine. Why do I know this? Because we, Senator Rivera and I, were in the legislature and we passed this law. We were very proud to pass this law to provide protection because paid sick leave is not actually something that was on the books. This is an example of a moment in time happening, pushing us to do the right thing. And so we did. And so now there is paid sick leave for those who are affected by COVID-19. What employees need to do to get an order of precautionary or mandatory order of quarantine or isolation because of COVID-19 is the following. Number one, contact your local health department. You can search for your local health department on the New York State Department of Health website. We will put that website in the chat for you, but for those of you who are not in the chat, the website is www.health.ny.gov/contact_information/.
I figured that's going to be in the chat box.
It's going to be in the chat because that's a hard one to take down. Your local health department should provide written orders in a timely manner. Again, any of the information that we're sharing with you right now, if you have a problem, if you have a roadblock, this is what we're here to do to help you to get through these roadblocks. If your local health department is unable to immediately provide you with an order, number one, submit documentation from a licensed medical provider that has treated you, attesting that you qualify for the order, and number two, follow up with your local health department to obtain the order and submit it to your insurance carrier as soon as it is available. Local health departments must provide requested orders within 30 days. Let me say that one more time. Local health departments must provide requested orders within 30 days. And then there is a link for the documentation guidance that we will share with everyone so that you have access to this. So the long and short is that there is an answer to this problem. If you, after following these steps, find that there is no answer on the other side of your inquiry, please, again, contact myself, contact Senator Rivera. This is what we're here for. We're here to help you guide you through this process, which, to be honest with you, I fully acknowledge that not everyone is used to navigating through government. So there could be a lot of different things that you might not be used to. So that's what we're here for. So please, please, please use us. So we have another question that has been submitted previously. And the question goes to Dr. Rosen. Dr. Rosen, from a medical standpoint, what are the lessons that have been learned from this pandemic when it comes to addressing the racial and socioeconomic disparities in health outcomes, particularly in the Bronx? You touched on this peripherally already, but really thinking about, right, like what does this look like on the other side of this pandemic? What have we learned? What can we take away? How can we do better?
Sure. So as more and more data become available, whether it's in New York City or nationally and in other countries, we're really seeing that Black and Latino communities are disproportionately impacted by COVID. And I think the spread of COVID has exacerbated underlying inequities and health disparities in our neighborhoods and in our city. So this really reinforces the need to ensure adequate healthcare resources and that information is available to those who most need them. And I think this is something that the agency is always thinking about, but really has highlighted additional things that we can work on.
Thank you. I know that at the top of many Bronxites' minds are really the things that we all know because we've seen them every day. It's the underlying comorbidities, it's access to healthy food, it's things like making sure that we are just having equity across the board so that no matter what zip code you're in, you are healthy, you are able to be well. And so I think that if anything has really cracked open this healthcare system, it is this pandemic. And so it is the silver lining, I think, because it will push us to face these things. And that's a good thing. But on the other side of that is a lot of loss, a lot of suffering. And so we acknowledge that and really want to make sure that we prevent that from happening again. Senator Rivera, I think you have the penultimate question to ask. If not, I will ask it. I'm happy to. It's a question again for Dr. Rosen. Dr. Rosen, can you please address how the city is helping New Yorkers deal with the inevitable psychological and mental breakdowns that are occurring and will continue to occur when the curve has flattened? I just want to say before you answer this question, because I believe in being candid, I believe in letting people into my world a little bit. This has been one of the most challenging experiences I have ever lived through, if not the most challenging. It has pushed the limits of what I think I can even bear as a human being. It has pushed the limits of how I deal with anxiety, how I deal with trauma, how I deal with helping others who don't have the means or the ability to even know where to turn. It's really pushed those limits in a way that has, I think, created inside of myself moments where I have felt hopeless. Now, I, of course, have luckily some of the skills practiced through mindfulness to be able to get through these times. But this, no doubt, has challenged every single one of us, whether you're a New Yorker, you're from New Jersey, you're from the United States, you're from any country in the world. This has challenged humankind. And so there is a little bit of solace in the fact that we are connected through that suffering. But at the same time, we still need to be able to deal with it. And I think it affects every single one of us on a daily and really moment to moment basis. So I wanted to share that before you had the opportunity to answer, Dr. Rosen. So everyone who was tuning in really understood also that it affects even your lawmakers and your leaders in your community.
Yeah, thank you. I think that was really well said. And I do echo everything that you said. This is such a trying time for everybody and takes a toll on everyone's mental health. And Dr. Barbeau had highlighted the importance of thinking about this as physical distancing, but not social distancing. People do not need to continue to rely on others spiritually and emotionally, and maybe this is going to be done in a different way like we're doing with Zoom, but it's really important to stay connected with other people. And there, as she mentioned, there is free and confidential mental health support services available to all New Yorkers. She had mentioned NYC Well, which is a 24/7 service. You can search online, nyc.gov/NYC Well, but the phone number also is 888 NYC Well. And there's another service too. It's the New York State COVID Emotional Support Hotline, which has hours 8 a.m. to 7 p.m. 7 days a week. And that phone number is 844-863-9314. And these services have trained counselors available to speak with people. So I do encourage people to reach out.
Thank you very much, Dr. Rosen. And I just want to also echo, I know how hard it is to ask for help, whether it's help emotionally, whether it's help financially, or whether it's just help overall. But really, this is why we're here. This is why we're doing these gatherings virtually, because we want to make sure that if you've never asked for help before, there's nothing to be ashamed of. That is why we're all here. I have asked for help so many times in this crisis from so many people around me. I never even thought I would ask for help with certain issues. And honestly, it's the only way that I'm able to best serve all of you. And I know that this is the way that, again, connects us. So please know that even though it's really hard to ask for help, that is what we're here for. We will have no judgment. No one will know. This is why we are existing, to serve you. So we have one final question. It is probably on one of my favorite topics, which is the youth. If anybody knows me, they know that I love to engage young people. I love to have conversations with them about being civically engaged and civically minded, and also about their futures and what's possible for them. And so you can imagine that if you are a young person right now just entering the workforce, this is a hard time because it's a hard world to enter the workforce into. And so the last question is for Deputy Mayor Thompson, and it was a pre-submitted question, and the question is as follows. How is the city engaging with and supporting young adults who are just entering the workforce?
Let me say that the mayor has said that we need to come out of this crisis and recover, not to go back to how we were before. And I would compare to the crisis we're facing with youth employment, young adults employment, to the end of World War II, when millions of soldiers returned from the war without jobs, when millions of women who had worked in the factories, in the war production machines, suddenly didn't have jobs. And the federal government at that time created the GI Bill. They trained 600,000 workers to create the modern building trades. They gave 60,000 full scholarships with food stipends and housing stipends for doctors. They created and funded programs that trained hundreds of thousands of nurses. And these are the things that created the middle class that everybody talks about all the time. It was these federal programs. We got to push the federal government to do this again. And then the city has to do the same thing with whatever resources we have. And I mentioned before that job training is going to be a critical piece of this so that young people can move into new kinds of careers. Some estimates are that 50% of minority-owned businesses may not come back. A lot of people are going to have to find new ways to work, and we have to make sure the pathways and ladders and programs are there so that they can do that. Before the virus, we were about to go to Albany to ask for legislation to mandate that 30% of everyone on a New York City funded construction job had to come from a high poverty zip code or NYCHA. We're going to come up to Albany and ask for that because, we need to make sure that young people, these jobs are available and open to them. And these are not dead-end jobs, minimum wage jobs. These are jobs that can lead to a person to become a carpenter or a plumber or an electrician. And as we green New York, we're going to have to retrofit hundreds of thousands of buildings. It really should be the young people of the city who get those jobs, who are trained to get those jobs, not people flying in or moving in from around the country to do stuff our young people can do. So we just have to make this a priority for the city moving forward, and that's what we're working on.
Thank you so much for that answer. Gustavo has a curveball that he'd like.
Yes, I have a curveball, but it's actually as we're coming up to the end here. It's actually a question that I asked, the last question that I asked on the town hall that I did, as a way to kind of get us to we've been thinking about all the issues that we have, all the challenges that we have, and all the ways that we're going to deal with them. And I wanted to kind of end on this type of note. The question is, what is the first thing you're going to do when this thing wraps up? When we can actually start to be amongst each other. And I'm gonna answer first, if I may. My extended family, like my immediate family is down in Florida, but my extended family is actually my staff, the people who work for me. And I love these folks dearly, and I miss not being in the same room with them. So, and I have, in my district, I have Arthur Avenue. So the first thing I'm gonna do is I am going to, because it's probably gonna be either the summer, or late spring, I am going to walk from my home all the way over to Arthur Avenue, which would be like a nice 20 to 30-minute walk. And then I'm going to meet my staff in one of my favorite restaurants, and I'm going to take them all out so that we can all sit around a table and just kind of enjoy each other's company, have some good food, have some good camaraderie, and actually be able to see ourselves in the same room. That's what I'm going to do. How about you, Senator? What are you going to do?
I love this. This warms my whole heart. I mean, that is beautiful. And so let me take like a dip first. Okay. So the first thing I'm going to do, I haven't seen my parents, even though they live on the other side of town, for about 8 weeks now, because I've been kind of in and out of my apartment, whether it's in the community or in Albany. And I really don't want to, I don't have COVID, but I don't want to be going in and out just in case I am someone who's just an asymptomatic carrier. So the first thing I'm going to do is I'm going to walk from my apartment to my parents' house, and I'm going to hug them because I'm used to seeing them almost every day. And this has been a really hard time. And then I'm going to celebrate the heck out of my team as well, because my God, I've never seen people work so hard in their entire lives. And I wouldn't be able to do this without them either. So that's a very good influence.
Superintendent, how about you?
I was waiting. I'm going to find where Senator Rivera is on Arthur Avenue. But my mother is on the other side of the Bronx, and I haven't seen her because I'm married to an essential worker. So I'm going to take my husband out on a date. I'm going to make him take a day off.
Yes.
And I'm going to go and give my mother a hug.
There you go.
That's so nice.
Deputy Mayor, what do you think?
Well, I have a cousin I grew up with, and he lives on Theriot Avenue in the Bronx. And he gave his kidney to his sister like 20 years ago, and then his other kidney went bad. So he had a kidney transplant a couple of years ago, and he takes immune suppressing drugs, so he is super at risk.
Yeah.
And I haven't been able to go see him, and I'm even scared to go 6 feet away.
Yeah.
So he told me about this restaurant called Patricia's on Arthur Avenue, I believe, or around there.
Okay.
And he said it's better than that one Enzo's or whatever, which is in Pelham.
Oh, we're going to have a competition now? Okay. Okay.
I'm going to go check it out, right? Because, Enzo's is very good. I love it. He said Patricia's is better. So I got to.
Patricia's is pretty good, I have to say. It's in District 34. We love Patricia's.
Zero Tono is also very good. Just saying, Roberto's around the corner. Just so many to choose from. Last but not least, Dr. Rosen, what do you think?
I love what everyone else was saying, and I agree. Go see family, for sure.
So we'll invite you as well. So back to you, Senator Biaggi, but I just wanted to kind of put that there.
I love that. You just ended it in such a meaningful way. Honestly, this has been such a joy, such a pleasure. All of your answers are so heartfelt. And I hope that everyone who has joined us today has really taken away something to bring back to their own lives, to be able to help you. And again, just remember, we're all here to serve you and help you. So please reach out. Thank you for your time. Thank you for being here with us. Very, very grateful.
Thank you.
Be safe, everyone.
You.